Folks, Nick the nurse here. Today we're going to be talking about some of the nursing interventions associated with the nursing problem of hypercalcemia. Now, probably the dead giveaway on a nursing school exam in terms of nursing interventions that you should be able to identify is you need to monitor calcium levels. Well, duh, of course, but a lot of students miss that, so make sure that you're thinking about the basics. If a patient you suspect might have hyper or hypocalcemia, make sure that you monitor those calcium levels. You also want to monitor the patient's intake and output because if you'll recall in our signs and symptoms video, the patient might have polyuria, so keep that in mind as well. You also want to monitor for dysrhythmias. This is so important. Make sure that if you have a patient who's suffering from hypercalcemia, that you monitor them for arrhythmias. Why? Because it's a patient safety concern, and you need to know what's going on with your patient so that you can keep them safe. That's an automatic call to the doctor. You need to make sure you recognize and remember that. You want to encourage the patient to refrain from eating foods that are high in calcium. Why? Well, their blood calcium level is already elevated. Probably not the best idea to give them some food that is high in calcium, so stay away from that. You want to assist the patient, or assist the physician rather, in preparing the patient for a parathyroidectomy. Well, why is that? Well, if you'll recall in our risk factors and causes video, we talked about how if a patient has an overactive parathyroid gland, i.e. they suffer from hyperparathyroidism, they're going to have a calcium level that's going to increase. So keep that in mind. So if the calcium level gets too high, the physician might just yank those parathyroid glands out, and they might just kind of go from there. So keep that in the back of your mind. You want to advise the patient to avoid foods high in vitamin D, because remember, with calcium, vitamin D helps solidify that calcium into bones. Very important. We want to encourage fluids. Monitor the patient for fractures, because the patient might develop fractures as a result of having hypercalcemia. We want to monitor their vitals, monitor them for confusion, because confusion can be a sign or symptom of hypercalcemia. We want to administer loop diuretics as ordered, because those can help lower the calcium levels. And we also might want to administer calcitonin if that's ordered, because if a patient has severely elevated calcium levels, we want to keep that calcium, under control. Additionally, you want to strain the urine for renal calculi or renal stones or kidney stones, right? Why? Because a patient who has an elevated calcium level is at risk for developing kidney stones. And as anyone who's had kidney stones before can tell you, and I've had one myself before, it's one of the worst pains in the world. So make sure that you strain for kidney stones there. And anticipate that the physician might actually order hemodialysis if the calcium level is too high, for example, if the kidneys fail. So you have to get that calcium level down, otherwise the patient can suffer from heart damage and suffer from life-threatening arrhythmias, and might even suffer from neurological damage from having a calcium level that's too high. So a lot to think about. Make sure that you commit these nursing interventions to memory so that you can do well on your nursing school exams and on your NCLEX and achieve your dream of becoming a nurse. Again, my name is Nick the Nurse. I'd like to thank you for watching my video today. If you'd like to check out any of my other completely free videos, they're all located at www.nickthenurse.com, or you can subscribe to my YouTube channel, Nick the Nurse. Thanks for watching. I'll see you next time.